Let's practice the medical interview. I will choose Christina, 40-year-old woman with tiredness. Let's get started. Before I start, I'm going to turn on the listening so I can speak to ChatGPT.
Case study. Christina, 40-year-old Hispanic female chief complaint. Tiredness patient details. 40-year-old Hispanic female symptoms. Persistent tiredness, weight gain, feeling cold, dry skin, past medical history. Depression, family history. Mother. Hypothyroidism, sister. Hashimoto's thyroiditis, objective symptoms. Elevated TSH, thyroid stimulating hormone, low free T4, thyroxine, assessment. Primary hypothyroidism management plan. Start levothyroxine, check thyroid function in 6 weeks, social history. Sedentary lifestyle, works long hours as an accountant, summary. A 40-year-old Hispanic female reports increasing tiredness, weight gain, feeling cold, and dry skin. Family history is significant for hypothyroidism and Hashimoto's thyroiditis. Objective findings include elevated TSH and low free T4, indicating primary hypothyroidism. Plan includes starting levothyroxine and rechecking thyroid function in 6 weeks. You can now start the interview with Christina by asking her questions about her symptoms, lifestyle, and concerns.
Okay, we're going to start the interview, and I'm going to put on the timer for 5 minutes. Good afternoon, Miss Christina, isn't it?
Good afternoon, Doctor. Yes, I'm Christina. How can I help you today?
Christina, I'm Dr. Dennison, and I'm a student doctor at St. Mariana Hospital. I am going to ask you a few questions today, and I'm going to take some notes. Is that okay?
Yes, that's perfectly fine. Drive. Dennison. I'm happy to answer your questions.
All right, my first question is, why have you come here today?
I've been feeling really tired all the time, and it's starting to affect my daily life. I've also noticed that I've been gaining weight even though my diet hasn't changed much. I often feel cold, and my skin has become quite dry. I'm worried something might be wrong.
All right, let me first focus on your first issue. You said you feel tired all the time. How long has this been going on?
I've been feeling this way for about 6 months now. It started gradually but has been getting worse over time.
You said it was for about 6 months. That's a long time. Has anything made it worse during that time?
Yes, it does feel like a long time. I can't pinpoint anything specific that made it worse, but my work has been pretty demanding lately. I work long hours as an accountant, which can be quite stressful. That might be contributing to how I'm feeling.
I see. Have you tried anything to make you feel less tired?
I've tried a few things, like going to bed earlier and drinking more coffee, but nothing seems to help. I even tried taking some over-the-counter vitamins, thinking it might be a deficiency, but I haven't noticed any improvement.
Okay, so you've tried coffee, you tried to go to bed early, and you tried some vitamins, and nothing has worked so far. Is that correct?
Yes, that's correct. Despite trying those things, I still feel exhausted all the time.
I see. And how long does the tiredness usually last? Is there any particular time you feel more tired?
The tiredness is pretty constant throughout the day. It doesn't really matter what time it is. I always feel fatigued. It might be a bit worse in the afternoon, but it's hard to tell because I feel drained most of the time.
Can you describe your tiredness in more detail for me?
Sure. It's a kind of deep, overwhelming fatigue that doesn't go away with rest. I wake up feeling exhausted, no matter how much sleep I get. It's hard to concentrate, and I often feel like I'm moving in slow motion. Even small tasks feel like they take a lot of effort. It's not just physical tiredness, but mental as well.
Oh, I'm sorry to hear that. You also mentioned some other issues as well. One of them is weight gain. Can I ask a few questions about that?
Of course, you can ask me about that. What would you like to know?
So how much weight have you gained?
I've gained about 15 pounds over the last 6 months. It seems like it happened gradually, but I noticed my clothes getting tighter and the number on the scale going up despite not changing my diet or exercise habits.
I see. Have you ever experienced weight gain or weight loss like this?
No, I've never experienced weight gain like this before. My weight has been pretty stable for most of my adult life until now.
I
This
see.
sudden change is unusual for me.
I see. And what were the other symptoms that you have concerns about?
Besides the tiredness and weight gain, I've also been feeling unusually cold, even when others around me are comfortable. My skin has become really dry, and I've noticed some hair thinning as well. These symptoms all started around the same time.
All right, thank you for answering my questions. I would like just to end the interview here. It seems that you might have something connected to your hormones, as it seems to be a whole body condition. We would first like to get a blood test to confirm that. Is that okay?
Yes, that sounds fine. I'm open to getting a blood test if it can help figure out what's going on. Thank you for your help. Drive. Dennison.
Thank you very much.